On this segment, I'll be speaking about community media-driven demand and accountability. I like to say that I have no conflict of interest in this report. Amplifying community voices in DRTB response. The Civil Society for the Eradication of Tuberculosis in Nigeria, also known as TB Network, is a not-for-profit organization established in 2009 and registered with the Corporate Affairs Commission in June 2010. The network has over 600 registered CBOs across the 36+1 states in Nigeria. TB Network represents the voices from the community for the community. And on the fast-track the cure intervention, we work in Katsina and Kano States. The FTTC project in Nigeria, which is the fast-track the cure, aims to strengthen community engagement and demand for BPaLM regimen through awareness, community-led monitoring, and evidence-based learning to improve treatment uptake and outcomes. The fast-track the cure project aims to strengthen community awareness and community demand for DRTB treatment, address stigma and sociocultural barriers, foster community accountability, and improve treatment uptake. Understanding the power of local voices in TB response. The challenge in Kano and Katsina States is a deep-rooted sociocultural norms, limited awareness, and gender barriers that has helped to shape health-seeking behavior in both states. So we performed a baseline assessment to understand these gaps. From the findings, we saw that there's low knowledge of DRTB treatment and options, myths and misconceptions, women-limited decision-making power, and then stigma and fear from having an open discussion about their status or disclosing that they have DRTB. So from the baseline, we got quotes saying, "When I heard the jingle in Hausa saying DRTB is curable, I told my husband to return for treatment." Some of the findings from the two states, we had the demographics, 157 respondents, 79K informant interviews were conducted, 78 focus group discussions, 82% were male, 18% were female. The target audience were those who have DRTB and their caregivers. The key informant interviews were community health influencers, policymakers, DRTB survivors themselves, and then healthcare workers. The challenges: more radio jingles and outreaches, high workplace stigma, social mockery, high transport costs to facilities, lost income due to DRTB, limited exposure due to mobility and cultural barriers. We also heard quotes from the respondents saying, "My co-workers stopped sharing food with me." This is a male from Katsina local government. "My husband's family said I brought costs to the family." This is a female from Funtua local government. Why do we want to use radio to break silence and build support? It is the most accessible medium to have or get information. It is trusted by the community members, especially in rural areas. It enables dialogue in local language, actually the Hausa, leading to reduced stigma, misinformation, and all of that. The approach we want to employ is to partner with communication experts, local radio stations, to develop and broadcast radio jingles that will be culturally sensitive to avoid reinforcing stigma, emphasize that DRTB is curable, and encourage survival to seek care. We also want to feature TB survivors so that their testimonies can inspire and reduce fear in the community. We also want to see that at the end of the day, there's expanded listenership and community dialogue, shift perceptions from silence to solidarity, strengthen community accountability through increased awareness and reporting. In the course of this work, we've also been able to reach TB survivors, DRTB patients, to access household economic strength, leverage on household economic strengthening, and also improve their diet. We also provide some kind of support to the staff to be able to access care, to be able to be more supportive to DRTB survivors. The project has opened the space for open conversation or discussion about DRTB as we push to improve the health-seeking behavior in both states. Thank you.